I first came to Penn State, I was a little worried because it's a little far away from home for me. I'm originally from Massachusetts, and it was the first time I was living out of state. So I had to deal with a little bit of homesickness, but I found a new home in Penn State.
And then going into medical school, as we were interviewing and selecting different places, I was really attracted to Penn State because of its great orthopedic reputation and also the focus on the humanities department. I think that's a great thing about our first 2 years of medicine and helps lead us forward into our clinical years. I know in some of my rotations that has definitely been mentioned by some of the attendings that I've worked with, that Penn State students are very good at empathizing with patients and connecting and not just walking in there and seeing a disease. So that's what really kind of set Penn State apart from the rest for me.
I remember I interviewed here twice, and each time that you drive in on 322 from my direction, you sort of come around the bend and then here it is. You see like the crest and it's all, it's lit up. I mean, when I came here, there wasn't a moment where I felt like I didn't belong.
I give back to the College of Medicine because when I went to school in the 1970s, my tuition in aggregate for the entire 4 years was $10,000. Such is not the case now. We do not want to select physicians for their ability to pay. We want qualified people who are motivated and not subject to the concerns about finances down the road. I'm proud to support students at the College of Medicine because the College of Medicine saw fit to take a chance on me when I was a non-traditional student. I feel an obligation to do the same for students that follow me.
I took 3 years off after college, so I'm a non-traditional, as they say, non-traditional student. And I guess the biggest challenge I faced was just self-doubt. I took the MCAT twice, and the first time I took it, I completely bombed it. I mean, it was just like huge blow to my confidence, huge blow to my ego. Having the honor of receiving the scholarships definitely validates like, okay, you should be here.
I actually worked during the first 2 years of medical school. I worked as a pharmacy technician at CVS and I worked in the library. I actually didn't end up working this year for the first time, and that was great.
So I actually got awarded this scholarship last year as well, and it was really helpful because it came in time right before I went to a conference in upstate New York, and so it covered my travel expenses for going to that conference. And then winning the scholarship this year allowed me to use that money to pay off the last remaining of my student loan. So I used that to write the last check and pay off my balance of my student loan debt.
I was recently accepted to residency at Yale Neurology, and I wanted to take this opportunity to thank all the donors that provided scholarship support to me during my last year of my medical education.
My family and I immigrated here from Poland, so I kind of had always in my mind to dream big. That's why we came here, for my family to give me the opportunity to kind of be whoever I wanted to be.
I'm super excited for July. I'm going to my first international conference, and so I'm presenting my work in France at a poxvirus-specific meeting, so this will be a really good chance for me to present my work to the experts that are specifically in my field of study.
I did have one student that graduated that sent me a note of thanks because he started with his college degree and then with my scholarships and then finished his medical degree and said, I owe it all to you, so that made me smile and still does. I'm sure that's not the case. He had to work real hard, but it makes you feel like you were part of something good. And that's nice. It's a nice feeling.
What I'd like to accomplish in my career is to establish a clinic and healthcare programs that could serve as a template to be used to help women and children in my home country of Ghana. I'd like to thank the Stabler Scholarship for helping make a young boy's dream become a reality.
To have the support of alumni like Dr. Momin meant a lot to me. Further emphasized how important the community is here. Even though he graduated a while ago, he still feels really connected to the College of Medicine and helping medical students succeed in their goals of becoming doctors.
To me, it means so much more than just a monetary reward. You know, I didn't just get a certain score. I didn't just complete a certain number of tasks. The people responsible for the scholarship looked at what I had to offer, and they trusted me with the money. They trusted me to represent the name and the values behind the award. And to me, that's what it means.